Hi everyone, I'm Dr. Rajeev Agarwal, gynecologist, fertility specialist and laparoscopic surgeon, director of Renew Healthcare Kolkata. And in this video, I will be discussing about what is post-menopausal bleeding. Before we discuss post-menopausal bleeding, we need to define what exactly is menopause. So in a perimenopausal woman, periods need to stop for a complete year for us to call it menopause, because irregular periods can happen in any woman, which is why we need to wait for at least a year before we can say that the episode is menopause. 5 things you need to know about postmenopausal bleeding. Number 1, and the most important, it is never ever normal. You can only call it normal once it has been investigated and we found that there is no sinister reason for having a postmenopausal bleeding. It happens in about 10% of women after they've achieved menopause. Each and every case of postmenopausal bleeding needs to be investigated. I do have women coming in all the time saying that, it just happened once and there was this one drop and it's not happened again and so on and so forth. What we need to understand is, in a small percentage of cases, it can be sinister, and the only way to find out that small percentage of cases is to investigate every single woman who comes in with postmenopausal bleeding. In 90% of such cases, the final results are not cancerous, and that is a huge reassurance. So don't get worried. Don't keep thinking that something horrible is going to happen to you. In most cases, you will be reassured that everything is all right and life continues just as normal. But for you to do that, you need to first get yourself investigated. And do visit your gynecologist if this ever happens to you. Why does postmenopausal bleeding happen? So in 90% of the cases, the reason is thin lining of the uterus or vagina. So after menopause, the estrogen hormones have been withdrawn, which causes thinning of the lining of the vagina as well as the uterus or the womb. Now, this thin lining cannot support itself sometimes and may flake or fall off, causing postmenopausal bleeding, an absolutely normal phenomena which does not really even require any treatment. But then to know this, we still need to investigate. Reason number 2, polyps can be present inside the uterus or the cervical canal. Now, what are polyps? Polyps are grape-like structures inside the uterus. I have another video where I've shown what polyps are like and how polyps are removed from the uterus. The third common reason is thickening of the lining of the womb due to hormonal therapy. Now, some women may inadvertently be taking certain hormones, which can cause thickening of the lining of the womb, and that can be causing bleeding in such women. Lastly, and the least common, cancer of the womb. So how does your doctor investigate you once you go and visit him? So of course the doctor will take your history, understand what drugs you're taking and so on and so forth. Beyond that, the more important things that your doctor will do with you is 1, local examination. So the doctor will put in a small instrument called a Cusco's speculum, which kind of opens up the vagina and we are able to take a look inside the vagina in case there is a local cause. If a pap smear has not been taken before, a pap smear will be taken because problems of the mouth of the womb can also cause postmenopausal bleeding, and pap smear is something which is very simple and every woman should have a pap smear done every 1 to 2 years. The second investigation is of course a vaginal ultrasound. A vaginal ultrasound is an ultrasound or USG done with a vaginal probe. That is the best way to look at the uterus from a very close proximity. We can actually figure out the walls of the uterus, the lining of the womb, any polyps that might be there inside, or any other cause that might be causing postmenopausal bleeding. Once all that has been done and your doctor has done some blood work as well, like thyroid, etc., then the doctor will take you up for what is called as a hysteroscopy. Now, hysteroscopy is a very simple procedure which is done under anesthesia so that you don't have discomfort. Of course, it can be done without anesthesia as well. Now, nowadays we use hysteroscopes which are so thin that they can be introduced into the womb without any dilatation, without any other support or help required, and it can be done as an office hysteroscopy as well. So hysteroscopy is a procedure in which we give you a short anesthesia to make you comfortable, and then a telescope is inserted through the vagina, through the mouth of the womb to look at the inside of the womb. The reason for doing hysteroscopy is both diagnostic as well as therapeutic, meaning when we put the telescope inside, we get to exactly see if there is a problem and where there is a problem, so we can tackle that exact point where the problem is occurring. Secondly, treatment. So if there is a polyp present, we could remove the polyp. If there is nothing else majorly seen inside the womb, we can take biopsies from inside the womb from any particular suspicious areas or generalized from all over the womb. And that testing, when sent to the lab, will tell us if there is anything sinister happening inside the womb. Now let's go forward and see during hysteroscopy, how does the womb look like in a postmenopausal woman. We're now inside the womb through a procedure called hysteroscopy, a telescope being inserted through the vagina, through the mouth of the womb to look at the inside of the womb. The patient is under very light sedation for just a couple of minutes, 2 to 3 minutes, within which time we both look inside and do whatever treatment is required. So what is the purpose of this hysteroscopy? It is two. One, to make a diagnosis. Two, to try and treat wherever possible. How do we make a diagnosis? The first thing we do is look inside the womb. Here we are trying to see what the lining of the womb looks like. Now with years of experience, you start to understand what normal lining of the womb looks like. And is this looking any different? Are there some blood vessels? Are there some problems? Are there some specific areas that we need to kind of target? Secondly, we scrape off all the lining of the womb and then try and remove that lining and send it for a biopsy, which both works as a treatment as well as diagnosis in case there is cancer, etc. So in this womb, you see that the lining was thick. We've tried removing the lining as much as possible, and then we'll go back again and remove some more once we've checked in. There was this one very specific area that we were concerned about. That specific area I'm removing with the help of scissors. That small tissue will be sent separately as compared to the generalized lining of the womb. So here that tissue is now free. So this is how a hysteroscopy works. Simple procedure, very valuable in the diagnosis and treatment of postmenopausal bleeding. I hope you like this video. Do like and subscribe to my channel and share this with your friends and family as much as possible.